The Asian American Pacific Islander Nurses Association of Nevada presents Healthy Mondays with Apina of Nevada. Start the week healthy and right with interesting conversations on living a healthy lifestyle. And now, your Healthy Mondays host, Dr. Marife Aczon-Armstrong.
Aloha! Good evening, naimbaga sardam, maayong gabi sa inyong tanan. Magandang gabi po sa inyong lahat. Maraming salamat po sa inyong pakikinig sa aming programa, Healthy Mondays. I'm yours truly, Dr. Marife Aczon-Armstrong, founding president of the Asian American Pacific Islander Nurses Association of Nevada and professor in nursing at Roseman University of Health Sciences College of Nursing. Did you survive the 4th of July Independence Day celebration? Ang daming pagkain na mahirap tanggihan, di ba? Fireworks everywhere. Kawawa naman ang mga house pets na takot sa paputok. Kung meron lang tayo na earplugs para sa kanila, di ba? Well, tonight, we are diving into a very important health topic. July is Minority Mental Health Awareness Month. Each year, millions of Americans face the reality of living with a mental health condition. Mental health conditions do not discriminate based on race, color, gender, or identity. Anyone can experience the challenges of mental illness regardless of their background, and however, background and identity can make access to mental health treatment much more difficult. National Minority Mental Health Awareness Month is observed every July to bring awareness to the unique struggles that racial and ethnic minority communities face regarding mental illness in the United States. The COVID-19 pandemic has made it harder for racial and ethnic minority groups to get access to mental health and substance use treatment services. This year, the theme of Mental Health Association's 2022 Mental Health is Back to Basics. After the last 2 years of pandemic living, many people are realizing that stress, isolation, and uncertainty have taken a toll on their well-being. Well, our well-being, as I belong to the minority population as a female older adult Filipina. And according to the National Institute of Mental Health, nearly 1 in 5 adults in the United States are living with mental illness. About half of the estimated 52.9 million individuals living with mental health conditions also suffer from substance use disorders or of drugs and alcohol. This epidemic hit an all-time high last year as the number of drug overdose-related deaths was over 107,662, according to the Centers of Disease Control and Prevention. 1 in every 5 children ages 13 to 18 have or will have serious mental health condition. Unfortunately, many people may feel uncomfortable seeking help due to the stigma surrounding behavioral health issues. By coming together to destigmatize mental illness and showing support for those living with behavioral health issues, we can help millions of people get the treatment they deserve. And tonight, we have a very special guest who I have known for many years, and I'm super proud of him and all of his accomplishments here in Nevada and beyond. Dr. Rhigel Jay Alforque Tan is an assistant professor of nursing at UNLV School of Nursing. He was the past president of the Nevada State Board of Nursing, appointed by the governor from 2011 to 2019 for 3 consecutive terms. He was inducted to the American Academy of Nursing as a fellow and one of the most prestigious and exclusive international organizations of nurse leaders and scholars. Dr. Tan initiated the first mental health law of the Philippines, known as Mental Health Act of the Philippines, through the Republic Act 11036, and initiated the first city ordinance in Cebu City related to mental health care sa barangay. He co-founded the Kalahi Philippine Folkloric Ensemble, a cultural community-based organization aimed to unite Filipino Americans in Las Vegas through preservation and promotion of Filipino heritage, arts, and culture. He is a Philippine Nurse Association of Nevada advisor, and he formed the Evidence-Based Practice Committee. Dr. Tan is a member of Clark County Emergency Corps and a member of the Sita Kappa chapter of the Sigma Theta Tau International Honor Society for Nurses. So without further ado, welcome to Healthy Mondays.
Thank you, Dr. Armstrong, and thank you for inviting me here. This feels like home at PHLV. Yeah, we have a lot of projects for community through media, through this station. So I'm very, very grateful I'm back again after the pandemic.
Yes, and it is our honor to have you in our show. Please say hello to our listeners and share your story.
Well,
Humble beginning.
hello everyone, and I've heard of and I've known of Healthy Mondays long time ago when I met Dr. Armstrong. That was years ago, and of course she brought this from Hawaii, right? So we're
Yes.
very, very fortunate to have this program also in Las Vegas. In Las Vegas we have a lot of minorities. Also, of course, it's not as much as ratio in Hawaii, but Filipino thrive in Las Vegas community. So the minorities here are also very, very strong. So it's so nice to have somebody who initiated a program like this, who looks at the health and the welfare of the minorities, the Asian population, and Pacific Islander in this big town of mixed culture and diversity.
Yes,
So I want to say hello to everyone who's listening. This is vibrant Las Vegas with all its flair for the various culture mixed in one. We call it Vegas.
Yes, Viva Las Vegas. And if you can see Dr. Tan's outfit and my outfit, we represent the Filipino culture.
Yeah, and we're very proud of that. And of course, I have to compliment your favorite color, your purple.
Purple, yes. It's the color of royalty, right?
It is. It is the color of royalty. And also, it stands for mental health.
Yes. Oh, that's good.
Yeah.
Well, I like purple because it makes me happy.
Oh, good.
Well, Dr. Tan, can you share with us your story as a minority health care provider and how it came about?
Wow, a story as a minority healthcare provider and how it came about. Well, I'll summarize it really quick. I'm one and a very proud Filipino nurse, I would say. And I kind of pause a little bit when I say Filipino nurse because I'm not just a Filipino nurse. I'm an OFW, and I'm very proud of that I integrated into the mainstream healthcare of the United States and coming over as an overseas contract worker, just like many of the Filipino who are considered our heroes. I came over here to work, and I'm in contract at that time. So that's why I got hired. But I came over here, I always believe that you make good, better, best, and do the most you can. So after that stint of about 5-6 years of being a contract worker, a nurse who has to work here under H-1A visa, I further my studies. So I have to keep going on until, to cut the story short, I went into the academia. I finished 3 nurse practitioner degree, 2 master's degree, and then my doctorate degree. So then it propels me to some other bigger tasks, not just caregiving at the bedside. I went into leadership, academia, publishing, and leadership roles, and then until I become in the board of nursing, and that's I'm very, very proud about. I'm
Yes,
very proud
we're
to
all
say
proud of it.
from OFW to
Filipino.
become the first Filipino president in Nevada State Board of Nursing for 3 consecutive years, and then that's appointed also by the governor. By then was Governor Sandoval, and then elected into the position of being the president, and then propel myself out into national, where I become the committee and then later on the chair for NCLEX, National Council of State Board of Nursing, under NCSBN, for the examination for nurses throughout the U.S. and Canada. And I've been doing that for a while. That was my passion until we created the new exam coming up in April 2023. So I'm one of those pioneering pillar and author of that exam coming in 2023.
Everyone is excited and at the same time scared about it because it is, as you already know that a lot of the nursing students right now who's going to be captured with that new set of questions to make sure, and our listeners out there, let me give kind of background that we're making sure our future nurses are safe and
Exactly.
competent, and the questions are geared more on the application of what they know. So
Yeah,
you
Dr.
can
Armstrong,
elaborate.
it is.
Yes.
You are a clinician at the same time. You are an academician. So you very well understand that the trend in the U.S. right now has been evolving to a higher acuity type of patient. So we are nurses, and nurses in the front line has to be geared to what the expectation and the quality of care that we have to maintain in taking care of a more sick population in this country. So that's the reason why we have to bump up the trajectory and the approach in evaluating nurses who's going to take care of us and our family in the future.
Exactly.
That they have to be at par in safety.
They have to be able to do good clinical judgment, right?
They
I think
have
that's
to.
the concept when they need to be able to think on their feet. So I think our theme for today is more mental health, and that's your specialty too, Dr. Tan. So can you tell us about your role as an Asian healthcare provider, and what are your strengths and areas for improvement when taking care of the minority patient population?
Well, that's going to be a challenge. Although it is always my priority is to take care also of our own community, and that is our Asian American Pacific Islander community in Las Vegas, and more specifically the Filipino. The challenge there, Dr. Armstrong, is that this community has a certain level of being naive, if not being scared, if not stigmatized mental health. That's one of the challenge I have, because although I advertise myself reaching out in the community, nonprofit organization, in churches, I even deliver, and I'm willing to take care even the uninsured AAPI, Asian American Pacific Islander community, to take care of their mental health as a nurse practitioner in mental health area. I don't mind, I will see them even if they don't have insurance, but the challenge is from them. A lot of our members in the community and AAPI don't readily reach out for that help. Why? There is such a thing of being scared, if not being scared, being ashamed, or collectively stigmatize the care. So that's one of the challenges, how to reach out. Although the service I made available, only very few. I'm telling you, in my practice, Dr. Armstrong, I take care of about 1,300 patients.
Wow.
And they come in different times because I follow them up. I open their care. I follow their care. Only a handful are AAPI. I could tell you, less than 10.
And that number doesn't really represent of those who actually have mental health illness.
It does not. Based on what your introduction, even, it does not. There are more out there who's actually not reaching out to help. It's part cultural, and we cannot just change culture in our lifetime,
Correct.
So that's one challenge that I have to see, aside from stigmatizing it. AAPI tends to minimize, and I would even say AAPI, Asian American Pacific Islander community, individual, if not family, tends to they tend to make mental health a physical problem instead of identifying it as a separate medical problem. Why? If they start feeling depressed, they start feeling anxious, they have their mood swings ups and down, they would even say, oh, it's just probably because I have a headache. They make physical reason to cover up their emotional and behavioral problem, because culturally, a lot of AAPI culture identifies that emotional and behavioral problem is something that you could just do something out. You could just keep
Snap
it
out of it, right?
Yeah.
You
and
don't
not
realize
think about
that-
it and
yeah.
don't realize it's a real medical problem. So they replace it with some other physical reasons so that they don't have to go to mental health providers. That's one challenge.
I think one example is when someone is getting depressed and they are sleeping a lot and they're just laying down in bed instead of helping with the chores, and they would say, "Oh, lazy." You know, they don't, and then you don't realize it. Yun ang kailangan nating magtatagalog ako. Yun ang kailangan nating ipaalala sa ating mga kababayan na pag nakita nyo ang loved ones nyo na dating vibrant, laging masaya, laging outgoing, tapos bigla na lang silang nagkukulong sa kwarto, may ibig sabihin yun. Ibig sabihin na may nangyayari sa inside, yung sa isip ng tao.
Exactly.
Yeah.
And that you hear it right. Something happened inside sa isip ng tao, behavior and emotion. But what they fail to understand and what our culture failed to communicate over generations is that emotions, yung feeling mo, yung matamlay ka, sad ka, is a real medical problem, and there is a diagnosis called depression. It's not about your lack of strength. It's not about your lack of faith. It's about your physical chemical in the body that might have some imbalances and it needs a medical attention. Hindi yan lack of strength.
So akala lang ng yun ang kailangan nating ipaalam sa ating ipaabot sa ating mga kababayan. At saka hindi lang sa ating mga kababayan, iba din na ethnic minority.
Or other ethnic minorities, they too have their own culture that's unique to them.
Yeah, and so the other what does minority mental health awareness mean to you?
Well, it's big to me. Although very few people tend to seek mental health from the minority group, it is who I am too. So it is very meaningful to me that for me, everyone, not just the minority, have the same potential for mental health issues. So therefore, they can avail of the same services to help them out. And to single out the minority means to reach out to a very unique population in the community that needs extra attention and needs extra guidance to be at par with the rest of the community in trying to avail the help there is available to them so that they live a very meaningful life in the new community that they're integrating in. So that they will be a part like everyone else, not to be excelling, although we want, but they're just the same as everyone. So even health is inert to them, is in nature to them, that they can also avail only if they identify they need help. So they're a very special group of people that I would like to also cater as well as to guide how to seek help in order to improve the quality of life if they are those that is affected by mental health problems.
I think the first thing is for the individual or the individual around this individual, the people, the support system, is accepting that there is a mental illness that existing. Until then, they will not seek out for help because they don't think that there is something wrong.
Yeah, and I have to add that until then, that they at their time understand that it is an actual medical illness, just like physical illness, they need to be supported by education. And I kind of like this program that you're running because this is, a day-to-day example where we reach out to the grassroots, to the people right in the community who might not have medical background, but once they start hearing this, they start realizing, and it starts to be a household concept. And that's one of my advocacy, Dr. Armstrong, is that I would like, I cannot educate everyone.
Exactly.
Although I want to, and this is one program that will bring education to the masses. But my little baby step is to make mental health a household discussion. Because among Asian, American, Pacific Islander, and the minority community, mental health is never talked about at home. We talk about if we have fever. Now we talk about if we have COVID. But we'll never talk about if we have depression, anxiety, or mood swings. But it only when we start talking about mental health in our household that it becomes a day-to-day activity. That when you start feeling this, then you start opening up to get help.
Yes.
I think that's a baby step forward there.
And I think when they hear, nakikinig sila sa atin ngayon, hopefully yung mga nakikinig, take down some notes or realizing, yun pala.
Yes.
Ganun pala yan. Kasi this is the only way na ma-increase ng awareness. Kasi pag lagi mong naririnig yun, maaalala mo, ganun pala. Si Maria o kung sino yung nasa harapan mo, ganun palang nangyayari sa kanya. Alamin natin kung ano pang nangyayari. Kasi sometimes, I know at one point we have to give people medications, right? Because of the imbalance, the chemical imbalance. Pero sometimes, kung naagahan na malaman nila, ganito palang nangyayari. Minsan yung dialogue lang nakakatulong na sa tao, right?
Exactly. Talking about it makes it normalizing the topic.
Yes, that's
our goal. Normalize the topic of talking about your emotion. Normalize the topic of talking about how you feel. Don't hide it. It is not a sign of weakness. It is not a sign of being lack of faith. It is a day-to-day normal feeling that needs help from professional, and there is help.
And lahat naman tayo at one point ng isang araw, malungkot tayo, hindi ba?
Exactly.
Ako din minsan, why am I feeling sad today? Sometimes it's the weather, when it's so dark outside, you can't see the sun. I used to live in Cincinnati, right? And in Cincinnati at one point during the winter, you can't see the sun. And then you look outside, there's snow, and then the trees are all like twigs, right? There's no greenery. Siyempre, at that point, na malulungkot ka na, parang nakaka-depress, hindi ba? Pero yun namang hindi depressed na to the point na kailangan mo ng medication. Ibig kong sabihin ng, di ba yung pagsabi mo, nadidepress ako kasi walang sun,
and it's okay to say that.
Yes.
And it's okay to say because that's how you feel,
yes.
and that's how you should be heard. And it's normal.
Yes.
Everyone have those moments.
Yes.
There are only specific times that the depression becomes so unbearable and becomes so deep that it prevents you from doing what you used to do in your routine, and it affects your life. That's the point that you need to seek help.
Pag hindi mo na magawa yung mga everyday na gawin mo, halimbawa hindi ka na makapagsipilyo sa umaga o gusto mo na lang mahiga, right? Iyon ang mga dapat na malaman ng ating mga kababayan.
Yeah, yung mga symptoms na yun.
Yes.
Matamlay ka, hindi mo na enjoy what you used to enjoy. Gusto mo sana, noon you enjoy going to movies, mag-swimming, ngayon, ayaw mo na. That's
o mag-dancing,
a change.
o mag-dancing o kumanta.
Bigla na lang, I don't feel good. I don't want to do the dancing. I know I love it before, but I don't have the motivation to do it. Parang wala na akong energy to do that. Those are signs and telltale signs that there might be some depression creeping. Feeling mo hopeless, feeling mo worthless ka, hindi ka na, guilty ka palagi, you're not just anyone else, you're not good as anyone else. Those are symptoms of depression. Pati yung irritable ka. Bigla ka lang nagagalit at saka bigla ka na iiyak or hindi ka na nakakatulog where normally kailangan mong matulog 6 to 8 hours, hindi ka nakakatulog or it would take you time to go to sleep. Yun yung mga sintoma din ng mga depression na meron kang mental health issue. So those are things, if you notice that, seek help, talk about it and get help. Kasi ganito, Dr. Armstrong, yung message din natin. A lot of people seek help because they have diabetes.
Yes.
For example. Of course, they have diabetes. Control natin yung sugar. Kailangan mo ng insulin. Right? Or any medication, tableta, or pang injection para makontrol yung insulin. Emotion is the same. Yung naging depressed ka, matamlay ka, anxious ka, apprehensive ka, takot ka palagi, na wala namang reason, iba ka, the same ng diabetic, na yung ng chemical sa body mo na imbalance, meron ding mga chemical sa body mo na mag-i-imbalance na mag-cause sa'yo to feel that way. Kaya yung medication is kailangan para ma-balance it out and life would be worth it.
Kasi maraming tao, there's a lot of people out there, they don't believe in medications.
I know it's a culture we have too.
Culture. So, what other mental health conditions and disorders do you observe among the minority population? And what are your insights with the possible risk factors or causes?
Well, one is
We're
if
already
I
talking
have
about the
to look at
depression.
depression and anxiety
Yeah.
is really big for us. Well,
Big
one, integrating to a new environment, lalo na yung mga galing Pilipinas, galing ibang bansa, and came over here to the US to start a new life. Sometimes integrating pakikisama sa bagong environment can be stressful. So nasi-stress, nag-increase yung anxiety, nag-increase yung depression, then that's very, very common that I've seen. Yun yung makita ko eh. And what are the factors that attributed? Migration that I've said, but very important big thing too that you should not forget is it's also genetic.
Yes.
It is genetic, It's
Yeah.
not of your fault. It's just the same as the color of your hair, the color of your skin that you inherit from generations, your mood, your feelings and emotion, as well as the chemical that controls it can be also genetic.
Inherited. From
Oo.
your
Parang namana mo.
Yeah.
It's nobody else's fault. It's not anybody's fault. But what you want to think is if you have that condition that it runs in your family, there is help.
Yes, that's the most important message.
That's the most
there.
important message. We
Yeah.
cannot change the genes or the inheritance we get from our parents, but we could do something in our own at this time to improve our quality of life.
Alam mo, buti na lang binanggit mo yung tungkol sa mga immigrants niya. Kasi nung last week, shinare ko kay Matthew Dang na pagkadadating ko dito in 1977 after high school, nung nag-migrate ako dito sa Hawaii.
US.
Actually, sa Hawaii actually. Tapos within like few months, iyak ako ng iyak kasi 16 years old lang ko. Syempre, you need your acquaintances, you need your friends. Tapos wala akong friend doon sa Hawaii. So, gusto ko nang bumalik sa Pilipinas noon. Sabi ko sa mga parents ko, gusto ko nang umuwi. Tapos sabi ng mami at daddy ko, ito na ang bahay mo, dito na ang home mo. So I think we forget that the immigrant population who just came from the Philippines to the United States are also experiencing that.
Exactly.
Yeah.
That is a very potential real problem, that could happen because nag-i-elevate yung stress mo. Nakikipasama ka sa culture na hindi mo
Familiar.
familiar. And then the
Diba?
people around, hindi mo pa kilala. Your support is not there. So mental health is greatly affected by migration. I'm one of those. I migrated. I was already 24 years old coming over here and trying to start a life. So, hindi naman ako nagde-depress, but the potential of being depressed is always there to everyone. So that's what's make our community or the minority, I would say, at risk also.
Yeah, and the culture itself at saka yung kalakihan mo na ganito pala dito, ganun, iba ang culture, at saka syempre yung mga kaibigan mo naiwan mo sa Pilipinas.
Exactly.
Tapos you have to just start building your own circle of friends, right?
Exactly,
And it takes a while, just like you
And not
mentioned
only
earlier.
that, now you planted
Yeah.
yourself here. 1 year, 2 years, you get a little adjusted, but you still, and many of our culture, I would have to say, because I went through it too, in the Philippines, you still have responsibility to take care of them.
Yes,
so
that's
then
right.
financial support to your family in the Philippines can also be a burden while you're trying to implant yourself and adjust yourself to a new environment. So that's another factor that can play, that can make you at risk to have some mental health challenges.
Yung stress, yung
stress,
anxiety,
expectations,
yeah.
Responsibility mo, yung own living mo dito, yung adjustment mo dito, at saka yung family mo doon na sometimes we cannot take it away. They expect a lot for you and everything goes to you as your own, responsibilities. So nagko-compound yan.
Yeah. And ang dapat na ipahayag natin sa ating mga kababayan ay there are resources. At saka ang daming organizations dito na ang dapat nating gawin to reach out at make it known, and this is one way sa radio na alam nila mga resources.
Exactly.
Yeah.
So programs like this would educate the masses. So if only they listen, they participate, and they make notes perhaps, PHLV Radio through your program Healthy Mondays is a very good avenue to reach out to those individual out there in the grassroots in the community para malaman nila yung mga little bits that can make life more meaningful and can solve some of their problem, and one of which is mental health.
And also to find out all the different activities. Alam mo, kasi ang mga Pilipino, hindi ba tayo sanay tayo yung merong mga fiesta, merong yung gathering.
We're naturally social.
Yeah.
Individual. So we found our support through social gatherings, social activities where we relate to others. And that's true,
Yeah.
That is one of our strengths.
Yeah, so
That's one of our strengths.
Yeah, so Dr. Tan, what are some suggestions you have for our community in assisting with identifying early signs of mental health problems and the resources? I know you mentioned earlier a lot already.
Well, as what we've said, we talked with Dr. Armstrongs about the signs and symptoms of depression. Watch yourself. I mean, if there's anything else, start with your own. Look at how you feel, evaluate how you feel. Is there any changes? And then coming from your own, open up and seek help. That's the number one step. Acknowledge that there are changes, and it could be in this concept we're talking about mental health and behavioral changes. And if you do, don't keep it to yourself. Express it out and look for help in the community. That's number one. Number two, in a concept of family and community, share it to somebody that you trust. Talk about it. Express about it. Seek help not only professionally to start with, seek help from your community, from your family to start with, from your loved ones who probably could help you also identify the right person to go if you want to further your care and help. So be aware of yourself and able to express it out, then seek professional help. I think those are 3 simple steps that you could make a difference for your own mental health care.
The self-awareness.
It's self-awareness,
And,
yeah.
I also did some research out there in the website for some ways we can support and advocate for patients and even our loved ones struggling with their mental health. So one is expressing your concern. It's aligned to what you just said. Expressing your concern in a gentle manner. Talking about mental health can be emotional. Being gentle can keep an individual comfortable during sensitive conversation. Another one is be a good listener. Ask the individual questions and listen carefully when they tell their story. Ako nga, minsan, busy-busy, tapos may magkakausap sa akin, teka lang ha.
Kaya nga, normalize the discussion.
Yeah. So
Normalize.
tell them that there are people who care about them. That's very important, the support system, right? And letting the individual know their loved ones care about them and their healing can go a long way. And then the other one is explain that you can get them help. Many people may feel uncomfortable in taking the first step to find treatment, and offering up resources to find treatment can be life-changing during this process. And I think if you are working, you have your employee EAP. EAP, the Employee Assistance Program. Yeah, and they even give like 2 or 3 free counseling. I've used it in my work. And then the next one is be aware of the triggers. And Dr. Tan had talked about some of the triggers, for depression earlier. Individuals with behavioral health issues such as substance use disorders or anxiety may have certain triggers that impact their actions and emotions deeply. And being mindful of these triggers can support them during treatment. And watch out for behavioral changes, as Dr. Tan mentioned earlier. If an individual is exhibiting signs of anxiety, depression, anger, lethargy, yung sinasabi natin kanina na tulog ka lang ng tulog, napakatamad mo, or social isolation, can check up on them to see if they need help. And another one that I looked up is check in on them during recovery. Behavioral health treatment can take time, as Dr. Tan mentioned, so it's important to let the individual know that they have your support throughout the entire journey.
At saka
Yes.
i-add ko pala, Dr. Armstrong, we haven't talked about it, and I don't want to go the day without talking about it.
Go ahead.
That one of the symptoms of depression is actually thinking of killing yourself.
Yes.
Suicide
We
is a
need-
real
yes.
symptom of depression, and if anyone experience those type of thoughts about suicide, make sure you ask for help. It is not a thing to be ashamed of. That's a symptom of severe depression that everyone needs to acknowledge and seek help. That is not something you need to be ashamed about. It is something that you need to seek help for.
You need help. And also, if someone is telling you that they have expressing to you that they want to kill themselves, take it seriously.
There is no joke
Take
about it,
seriously. Yes.
Don't scare them saying, I'm going to call the 911, I'm going to call the police. But be very gentle saying, you know what? I acknowledge you need, it is a very unique time in your life, and I think help is best for you, and I'm willing to help you. You know?
Yes, I think, and this is another topic. I need to bring you back for this topic. Yeah. So
I
thank
just want to
you.
make sure I mention that, because that's a
Yes.
part of symptom of depression that nobody wants to talk about. Even the person who would feel it is ashamed to talk about it.
Yes, because they feel like, a lot of things going in their mind. One of the things probably is, I will make my loved one sad.
Yes, yes.
Or they feel useless, helpless, useless, and all those things, and they are very real. And I think, like you said, make it a household conversation.
Yeah.
So then you can normalize
make
it,
a
and
household
that,
topic and a conversation.
and then you start feeling comfortable in expressing that, I'm feeling sad today because something happened, or one of my best friend passed away, or something like that.
Yeah.
So. Yeah. So, time flies when we're having fun. That's
I
my
know.
cue.
Suddenly, it's like,
Yeah, so I need to bring you back for another topic.
Yeah. I'm very willing to, because this is a really good avenue, as I've said, to reach out to people. In fact, I have to tell PHLV radio management, I have some friends in Cebu who keeps messaging me about this radio station.
There you
Johan, I'm
go.
so proud of that. I have a
Yeah.
lot of friends from Cebu now who's messaging me. It's like, you have to listen. There's a radio station there in Las Vegas, and I said, of course,
Yes.
they're very close to my heart.
Yes. And so I always ask this to our special guest. Can you share a word of wisdom to our listeners out there that's related to our topic tonight?
I would say, mental health is a real illness. It is not something that you have to be ashamed of. It is something that you have to take care of, and there is care. There is care only if you allow, if you open up, and you talk about it. Make mental health a household discussion, and everyone will share that sensitivity of care to care for each other, and help is there.
Thank you. And you're so right, because we are composed of mind, body, and spirit. And you can't separate that. We have a body, we have a mind, and we have a spirit. So that's really good to remember that.
Yeah.
Yes. So
I would say lastly, though,
Yes.
for the people I have listening throughout the world, globally now,
Yes,
and
this
in
is
fact in the
globally,
Philippines
yes.
and in Cebu, I would say, daghang salamat sa pagpaminaw ninyong tanan diha sa Cebu, labi na sa siyudad sa Sugbo, where I'm very proud, Dr. Armstrong, to say I initiated the first law in the country to have a mental health law, and that started in the city of Cebu in 2017 and was adopted by the Philippine Senate in 2018 and become the law as the Mental Health Act of the Philippines. So because of that conviction, I encourage everyone, not only the minority here in the U.S., also immigrants and also those across the globe, talk of mental health, be open about it, seek help, and normalize the discussion. It will bring a long way.
thank you again, Dr. Tan, for being our special guest tonight. Sa pag-accept mo ng invitation kasi this is your first time to be my guest. You have been a guest for other shows.
I know you for a long, long time, but I thought,
you better come.
I thought that I was part of this already with you, but yeah, you're right when you said that.
Yes.
I've been to PHLV radio for many other reasons,
And I
so
wanted
advocacy and mental health is close to my heart.
Yes, and I wanted to thank PHLB Radio, Johan and Thora, for giving us this platform to share with our kababayan and all our listeners globally about mental health. So our listeners out there, remember, every Monday is a healthy Monday. Aloha!
The Asian American Pacific Islander Nurses Association of Nevada has just brought you Healthy Mondays with Apina of Nevada.